You know, there's a lot of medical questions still being sorted out surrounding the virus. Here with some vital answers is Dr. Zach Jenkins, an infectious disease expert from Cedarville University in Ohio. Dr. Jenkins, thank you so much for being with us. Your quick thoughts on the president's announcement that malaria treatment is showing encouraging results in fighting the virus. What do you think?
So I've actually been following some of the studies that have been coming out of China and some of the other countries surrounding some of those anti-malarials. And the working theory is that, so these things actually help the cell uptake zinc, and zinc actually inhibits the ability for the virus to replicate. And so that can greatly reduce the spread. So the theory is good behind it. And there's some data that kind of shows that we're able to kill the virus, but we don't know if that translates to good patient outcomes yet. So there's still some information that we need to get.
Yeah. Dr. Jenkins, COVID-19 symptoms are similar to the flu. How can we differentiate between the two?
So you're right, they are similar. Probably the most similar characteristic between the two is they do often start with a fever. But what's kind of unique about the flu in contrast to the coronavirus is that the flu you would typically see cause more achiness, more soreness, and potentially also some head congestion, sometimes runny nose and all those sorts of things. You don't really see that with the coronavirus so much. What you do see is fever being the chief symptom, and then also dry cough.
Okay, so you've laid that out. How contagious? Talk about how contagious is it compared to the flu?
So based on the data that we have right now, and I need to preface it by saying that we're somewhat limited as we learn more and more about this virus. But our understanding right now is the flu, most people will infect maybe a little bit more than one other person on average. In contrast with the coronavirus, you're looking at somewhere between 2 to 3 other people on average will be impacted by one person. So that is a major cause for concern. It seems to be more efficient at spreading itself.
What can you tell us about the fatality rate in the U.S. compared to the flu? And what do we know about who is dying? Is it mainly older people?
Sure. So from what we can tell based on the data, both inside of the U.S. and externally from the United States, most of the time with the flu, you're looking at less than a percentage of people that contract the flu that ultimately die each year. In contrast with the coronavirus, early estimates are suggesting that that is actually between 2 to 4% of all patients exposed to the virus. And what you're going to see is as we get more and more data and we start to uncover these patients who haven't necessarily been tested, as that denominator, that number of patients grows, that mortality rate might drop a little bit. As far as the second portion of your question, really, we are seeing older adults impacted the most by this as far as mortality. But what's startling is the CDC's released some preliminary data to suggest that for hospitalizations, about 40% of all hospitalizations are for people under the age of 40.
Across the country this week, as you know, social distancing has been the rallying cry. Do you think we're on track to flatten the curve, as they say, and avoid becoming Italy?
I think we're taking some very extreme measures. I was actually looking through some of this data yesterday, and we are a few days ahead of where Italy was when they finally ended up closing things like schools. So if you kind of compare our timelines, we are starting some of those initiatives early, but the true answer is only time will tell.
Real quick question, 30 seconds here. People are talking about preparing for the next 18 months. Is that, what's your take on that?
So what we know for sure is when we compare it to previous outbreaks, most of the time what you see is this initial mass outbreak, which is what we're experiencing right now. And then you usually see these little aftershocks, so to speak, so smaller outbreaks that occur periodically following that first wave. And those can actually last for months. There's concern that this could actually become a 5th seasonal organism. And if it indeed does, that will potentially make us have to deal with this in the longer term. Okay.
Dr. Jenkins, thank you so much for coming on the show and helping to bring some clarity to this issue at this very challenging time. Appreciate you coming on the show and hope you can come back.